I'm a student nurse at the University of South Alabama. Today I will be performing the enema skill. I would first like to acknowledge that in a normal hospital setting, my bedside table will be waist level. Now I will perform hand hygiene, gathering all of my equipment. I have my waterproof linen / bed protector. I am verbalizing the use of my bedpan. I have my washcloths and towels, my enema bag, my water-soluble lubricant, my pure castile soap, my goggles, and my clean gloves, and I'm also verbalizing the use of an IV pole. I will now don my goggles first and then my clean gloves. The next thing that I'm going to do is I'm going to grab my enema bag and I'm going to clamp my enema tubing. I have now clamped my enema tubing. So what I will do now is I will move over to the sink where I will fill my enema bag with 750 to 1,000 milliliters of warm water for the adult enema patient. I will also be placing my tubing on a firm surface that is clean, since this is a clean procedure. I have now filled my enema bag between 750 to 1,000 milliliters of warm water for the adult enema patient. I will now lay my enema bag on my bedside table so that I can add my pure castile soap. After I have added this soap, what I will do now is I will gently agitate. After I have done this, what I will then do now is I will unclamp my tubing, now priming my tubing. After I have primed my tubing, I will then reclamp, line my enema bag on my verbalized firm surface. I will now come over to my patient's bed, where I will raise my patient's bed to a good working height. I will lower my patient's side rails, and then I will position my patient in the left lateral Sims position. Now coming over to my bedside table, I will grab my water-soluble lubricant with my non-dominant hand. And with my dominant hand, I will hold my tubing. With my non-dominant hand, I will verbalize that I will be lubricating my tube. Okay? What I will then do now is come back over to my patient, and with my non-dominant hand, I will hold my patient's hip, and I will do this both firmly and gently, asking my patient to take slow and deep breaths during the procedure. Next, I will use my non-dominant hand to then spread my patient's buttocks, and the next thing that I'm going to do is I'm going to insert the enema tubing. I will insert this tubing going 3 to 4 inches into the stimulated rectum. I would also like to note that if my patient has any hemorrhoids, anytime during this insertion, my patient is able to bear down to facilitate the process. I have now inserted 3 to 4 inches. So what I would also like to do is, I would like to note that I will need to hold on to the tubing throughout the entire process. And what I will do now is I will verbalize removing my enema bag from my IV pole. Next, unclamping my enema tube. After unclamping my enema tube, I will then raise the bag 12 to 18 inches. And I will also note that I will need my bedpan near at all times. What I will then do now is, if my patient experiences any cramping or discomfort, I will lower the solution or the clamping of the bag, asking my patient to take deep breaths. Now what I will do is I will assist my patient using the bedpan or the BSC or the commode when my patient needs to evacuate. What I will do now is I will show you right here is where my patient's buttocks will be. My patient's buttocks will be right here. And right here is where it will go down towards my patient's thighs in this area. For documentation purposes, I will document the type and amount of enema, the time. I will document the position my patient was left in. I will document the amount and color of return, and I will document my patient's tolerance. Thank you, and this will conclude my enema skill.